Hello there, it's your everyday nurse once again. So, we are continuing with our discussion on sexual dysfunction. So, in our previous video, we learned about sexual dysfunction in men. Today, we want to know about the causes of sexual dysfunction, both in women and in men. So, please don't forget to subscribe to my channel, like, and also share. Please visit previous video for more content on sexual dysfunction in men. So now let's get into our video. So the most common cause for sexual dysfunction is stress. Most of the times when we are stressed from work, when we are stressed in our relationship, or hassles or things that surrounds us, it makes it difficult for us to sexually engage in intimate activities or get involved with our partner to have a successful sexual activity. So stress is one of those causes. The next thing we can talk about as a cause is sexual trauma. Most of the times, when you are growing up and you are abused sexually, it causes you to close your mind on other sexual activity. Most of the time, if you are a lady or a guy and at tender age you are abused by an elderly person, it makes you feel insecure. And when you grow up or when you get to a stage where you have to engage in sexual activities, it might cause you to have some problems, which might lead to either erectile dysfunction, premature ejaculation, or any other sexual dysfunction. So that is it. Another thing we'll be talking about as a cause is psychological issues. So most of the times when we are going through painful situation or when we are going through depression or when we feel depressed from things that surrounds us, maybe due to unemployment, financial crisis, losing a loved one, or going through something that causes you to be depressed or something that causes you to be worried, it makes it hard for you to engage in any sexual activity. We know that to engage in any sexual activity or intercourse, it comes from the mind. You have to psych your mind for it to get in the mood, to have that desire, to have that arousal, to have that orgasm, or to come. So, if you are not psychologically stable, it makes it difficult to engage in any meaningful sexual activity. The next cause we'll be talking about is diabetes. When you are diagnosed of diabetes, when your blood sugar is very high, it blocks your vessels, your blood vessels in your body. So it makes it very difficult for blood to rush, especially into a man's penis, for it to get erected to engage in any sexual activity or sexual intercourse. So this can bring about erectile dysfunction in men. And for women too, there is also a rush of blood into the woman's organ or vagina, which also aids in pleasure arousal and for orgasm. So if you have diabetes, it can also decrease your desire for any sexual intercourse. The next cause to consider is certain medication. We have certain medications that decreases one's libido, that is your sexual libido or your sexual desire or the drive for you to engage in any sexual activity. So if you are on drugs like antidepressants, it has the tendency of decreasing your sexual libido. However, it's different in every individual. So if you are on any medication which affects your libido, it can also lead you to developing a sexual dysfunction, either arousal disorder, impotence, erectile dysfunction, or any of the disorders. We also have age. Age. That is when you are aging, it gets to a point where your hormones are coming out, the things that are supposed to work effectively in you for you to get that desire for sexual intercourse or sexual desire reduces. So it also reduces your chances of engaging in any sexual intercourse, and this can lead you to having a sexual dysfunction. We also have loss of vaginal lubrication, and this is mostly in women when the woman has fear or anxiety and is not able to produce a lot of lubrication for there to be smooth penetration, then it can lead to a disorder known as sexual pain disorder, meaning she experiences pain during sexual intercourse, and this can cause her to not be aroused or not reach orgasm due to the pain that she may be experiencing. So, these are a few things we'll learn about the causes of sexual dysfunction. Please visit previous video for more content on your mental health, and don't forget to subscribe to my channel, like, and also share. Thank you very much. Meet you in the next video. Bye.